If you want to do maintenance, then you will need much less, treatments with these products. This is a patient that has undergone only a treatment with Aqua Booster for the under eyes, for the cheeks, for the jawline, and for the jowls. And you can see here how she has replenishment of volume everywhere around her face. So, when you want to do a treatment, you have to target different areas like correction of the volume, nasolabial folds, the marionette lines, the jowls, the contouring of the mandibles, contouring of the cheek, sometimes forehead lines, sometimes crow's feet. Let's start with the Infin Meso products, strictly the one I'm going to be using today. DNA as active? No, DNA is hydrolyzed. This is a question from Oscar. Thank you, Oscar. So, what is so unique about the Infin products is that it has a combination of hyaluronic acid with vitamins, amino acids, minerals, coenzymes, and peptides, all together in all these special and nice formulations. So really, you can play as much as you want with these products and get the result that you desire and what the patient is requesting. So this product has been formulated for indications like skin redermalization, improvement of oxygenation and hydration of the skin, antioxidant, leaving your skin looking firm and keeps it looking bright. This is the different types of meso that I was talking about. You have small, SML. You have RNA, DNA, BTX like Botox, eye booster, aqua booster, collagen, and the NHA, which contains multiple vitamins for the entire face. Do you usually mix the aqua booster with lidocaine? There is no need to do that. Now, in case we're going to use the eye booster now on our patient, if we're going to use the eye booster along with the amber for a sandwich technique, I use it usually for patients that have very, hollow eyes, very hollow lower lids. So what we do is a technique using a cannula, and then on top of that, we can use the aqua booster. The eye booster is very important for the tear valley. It contains hyaluronic acids, niacinamide for tightening, amino acids, and glutathione, which tells you that is also very good for patients that have darkening and pigmentation under eyes. This is a patient of mine. We did for her a treatment with eye booster. In this case, we used the sandwich technique. So why did I use the sandwich technique? Because she has a lot of hollowness and she has also pigmentation. So what we did is we used the cannula to fill up this hollowness in the lower lids. And then we used amber as, direct injection everywhere for the patient, for her under eye. Of course, it was not only one session, it was 3 sessions. This patient, she's a young lady. She came and she also used to have a lot of problem with tired eyes. She keeps on putting concealer around her eyes, and the more she puts concealer and makeup, the worse they were getting. So she was a very good candidate for the eye booster. Why? Patients that wake up and they have puffiness under eyes, they have water retention. It's very important for us to use for them skin booster. It helps them in making the skin healthier underneath the eyes. We reached to amber, so we spoke about aqua booster, eye booster, amber, which is the joker in Infin. It's for skin redermalization and reconstruction. It stimulates the collagen and elastin, improves oxygenation, hydrates the skin because of the 3 ingredients it has: the hyaluronic acid, the succinic acid for tightening, and the amino acids. This is a patient that has been treated with other doctors, and this is her before and after. So this product is really good for like young or older ladies that come to you and they really don't have any way of getting rid of these lines except for doing constant treatments with boosters like Ember. You can do for them, laser treatments, right? Like exfoliation, radiofrequency. But then if it's combined with the right mesotherapy treatment, you will get the best results. So it's either use the Ember, in this case, by itself, or you can use it in a combination with lasers or even chemical peels. You can start with the laser and then you can do your injections. Let the patient come at the beginning for at least once every 2 weeks as a therapeutic method of treating what is there, and then you can maintain, right? Just like when you go to the dentist, I always say this example. When you go to the dentist and you have a problem with your teeth, you go, the doctor fixes the problem, right? But if you go home and you don't wash your teeth and clean your teeth every night, the problem is going to come back. Same here. Therapeutically, you have to do the sessions, 2, 3 sessions, and then you have to maintain. I have a question. I also want to ask if it's not in the, but for the Infin filler, hard to push the syringe. Well, we have a surprise coming in. We have now new Infini fillers with lidocaine coming in. Very easy to push. And when I give you now at the end my Instagram, you can check how it's very easy to push it. We tried the thick ones, the thin ones, the ones for the temples, for the lips, for the cheeks, for the jawline. And you're going to like using those products. Not difficult to push, I promise you. For this lady, also they use for her Ember for the neck. You can do nappage or you can do, point by point injection. We reach to the collagen. Also same for skin quality, hydration, anti-aging, anti-wrinkles. It contains hyaluronic acid and collagen. Collagen, in my opinion, is very important for patients that have scars, open pores. You can either use it by direct injection. You can use it also with a dermapen, or you can use it by doing some dissection underneath the scars. We can show you that on a different webinar. You can also suggest to us if there's any certain topic that you are interested in learning about, whether it's acne scars, pigmentation, or any other presentation that you have most in your country or with your patients and you would like me to talk about and advise you of the best way of using the products or combination of our products to get the best results, let me know. This is a patient that has pigmented scars. She has been using collagen, but I also believe that this patient has been doing also chemical peels and lasers. These products are fantastic for combination with other treatment modalities. So this is a patient that has undergone, it's either use DNA or collagen alone or Ember for these small fine lines and wrinkles, or you can use combination of all three. Reaching to our DNA super booster, which is hydrolyzed DNA and RNA from plant origin, contains hyaluronic acid. It's good for the dehydration, flabbiness of the skin, wrinkles, uneven skin tone, and it's also good for giving volume for the patients. Immediate renewal and redermalization of the skin, like this lady that has been injected with DNA. The vials, they come in 10 milliliters, and you can actually inject the entire vial in the face, or you can start by 3 ml on each side and 2 ml on the neck. And the rest, you can use it for the rest of the face. Coming to our newest product, which is the F5. So again, just to recap, we're going to use under eye for our beautiful patient, Ember. You can do sandwich technique, eye booster and Ember. For the face, I'm going to do 5 points with Aqua Booster. And on top is the F5. So what is F5? Imagine you have a product that has hyaluronic acid, succinic acid, collagen, DNA, and RNA. Hydrolyzed DNA and RNA all together in the same vial. This is the super booster. So, combination therapies, all the questions that have been asked, I will send you in details the answers. So this is, for example, a patient. This is what I was telling you about the sandwich technique. Combining the eye booster, this is the patient that we did for her with a cannula, eye booster, and on top of it we did amber. Imagine how much puffiness she had. She's not a candidate for fillers, otherwise she will have a third layer in her under eyes. This is a patient that was treated with a combination of aqua booster and DNA, which we call 3D booster. It's very popular in Bahrain, as I've seen. Bahrain team, if you are listening. So they like to inject everywhere on the face and on the neck. Please, if you have any nice combination that you think is, super, and you would like to share it with your colleagues, share it with me, share it with us, send us photo, and I will be more than happy to show everybody your work. Here we are to exchange knowledge in between us. This is also 3D booster using aqua booster and DNA, and notice how the result is nice for the patient in terms of skin texture, pigmentation, finalizing wrinkles, and even volume. How did the fat pad disappear? Exactly, that's what I'm telling you. If you know how to replenish the volume in the areas where the patient has lost the volume, you will get the result same as if you were doing fillers. I will show you how the amber is going to be injected when we go live. Haha. Now comes the time of the triple booster. These are demonstrations of patients that we did for them triple boosters. Like I said, for the under eye, full face, and neck. This patient had major improvement in the under eye. We did for him amber. For the face, I did for him combination of BTX and L. Remember this combination. BTX and L is a very nice combination for patients that want to have a nice jawline and lifting, also for the cheeks, not only the jawline. For the neck, we did for him again amber, and I did nappage everywhere for the face, also with amber. He didn't need much volume. He needed some nice lifting, tightening, without anybody noticing that he's done anything to his face. This is also another patient. Also, we did for her the triple booster. Notice her under eye, she has pigmentation. So if you're listening to me very well, you would understand that in the under eye, triple booster that was used is a combination of eye booster with cannula and then direct injection with amber. The cheeks and the jawline, we did a combination also of aqua booster and F5, the one I'm going to show you now. And we finished off by doing nappage everywhere with amber. Nappage is very important to give a glowy, nice result to the patient. Imagine that this patient, with all the volume loss that she has here, she was only treated with triple booster. She has hollowness under eye. What would you suggest? Again, sandwich technique. Eye booster with cannula. On top of it, amber direct injection. What would you suggest for the rest of the face? I'm going to show you a technique that is going to take you from A to B. Before and after, you can see that she has droopy jowls, correct? She has marionette lines. She has a sad face. She has the nasolabial folds that are prominent. So how on earth did we give this patient a lifting as if she's done fillers? Well, I'm going to show you today how, with the 5-point injections using the aqua booster, on top of it, the F5 and nappage with amber, you will get this result. This is if you want to take a screenshot of some nice combination of mesotherapy treatments. Aqua booster with DNA. This is what we call the 3D booster. Aqua booster with BTX. Another trick is BTX with L. Don't forget this combination is nice for contouring and the bony effect. Aqua booster with amber. Basically, aqua booster, you can mix it with all of the ingredients. Aqua booster with whitening in case the patients have pigmentation. So The treatment protocols, like we said, it's either nappage. I will show you now how the nappage is done. Basically, you're going to do fast superficial injections to the skin, different than the point by point where you actually take your time and inject more product into the area, different than the skin lumps where you go really superficial and you leave lumps. This is basically mostly used for patients that have pigmentation and you want to get rid of this pigmentation, especially in thin areas like the under eye. The 5 points technique, what I'm going to show you, you're going to give a nice slit for the patient, and the retrograde, which is mainly for the patient that have deep lines, where we go underneath the line and we do some dissection, inject our product, and go retrograde. This is the nappage. This is the point by point. This is where you're going to inject superficially the bubbles, and actually the bubbles that are going to go away by themselves. The retrograde technique. And this is me. This is my Instagram, dr.natalie, Nathalie. And you're welcome to send me all of your questions. You can send me all of your requirements, inquiries, photos. Please show me everything that you have done. Before slide, please. Can you share the presentation? Yes, we can share, I think, some of the slides if the patients are requesting. Of course, text me anytime for anything that you need. Please share with me your work. I'm looking forward to see what you have done using Infin, because I'm sure that there are so many doctors and colleagues out there, also distributors that have their own ways of doing things that can also teach me and others on how to give a better result for the patients. Thank you. I will go over your questions now. You want the photos with each protocols? Okay, I will make sure to send it to Anna and she can share it to you. And in 5 minutes, we're gonna take a break for 5 minutes and we're gonna do now the magic of Infin live. Start?
Yes.
Okay. So, hello, my dear friends, colleagues, doctors, distributors from all over the world. And we're going to start now. I'm going to go very slow. We're going to go from A to Z. We'll start with our consultation. This is our patient. I'm Dr. Natalie, and this is Natalia. So, we're going to start by asking the patient what is bothering her. So what is it about your face that you want to treat? What is it that's bothering you the most?
Lines here, open pores.
Lines where?
Here.
Lines here. Everybody is concerned about these lines, even though these are smile lines. Everybody's supposed to have them when they smile. Okay. Open pores.
Yes.
What else?
Saggy skin.
Saggy skin. Where?
All around here and here.
Okay. So when you have saggy skin to the patient, the first question you're going to ask them is, have you lost weight lately?
A little.
Okay. So remember what I told you about losing weight and the losing fat, and after the age of 25, I'm not going to ask your age. After the age of 25, we lose every year 1 teaspoon of fat from our faces. So far, I have lost 15
Well done.
teaspoons. 40, I'm proud. Oh. Yes? With Infin, you can be 40. I don't look 40, I know it, because I do a lot of these injections. So let's start by assessing the patient's face up to down. And let's consider that Natalia today is coming for a consultation where she doesn't know what she wants. And we're going to ask her the whole bunch of questions for the entire face. So let's start with the forehead. Have you undergone Botox injections?
I did, but...
How long ago?
A long time.
Okay. Can you lift your eyebrows up for me? Eyebrows up to the max? Because it feels like you've done it. Yeah. Frown, 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 frown. Smile. So when a patient comes to you and she has very, very minor lines to her face, I'm going to show you today how with the nappage technique you can maintain the result of Botox injections. So patient can do Botox After that, you can advise the patients to take zinc at home and vitamin C because it maintains the results. Did you know this?
No.
Okay. And then another mode of maintaining the result is by using the nappage technique, okay, which we will do today. So I'm going to do nappage with which product? You were listening to me. Which product?
Oh my god, I forgot the name, but I knew it.
Start with
B.
B. Yeah.
B.
Amber.
Amber. Yeah.
So we're gonna start with amber nappage to the forehead. Smile. So you know that when we want to treat the crow's feet for patients, we can inject in this area, we can inject in this area, but most of the patients that have water retention, whether it's from taking proteins at the gym, you are somebody that loves the sun, aren't you?
Yes.
She adores the sun. That's why she has this water retention, which we call fistone. You see this triangle? I'll show you. Does it bother you, this triangle?
Yes.
I'm going to make it disappear today.
Oh wow.
So you forgot about telling me that you didn't like this triangle. So these fistones, which is water retention due to thyroid issues, smoking, lack of sleep, not eating well, drinking alcohol, sitting in the sun, which is the life. All of us. We can fix it today using the injections with amber. And I'm going to show you how. Okay? I'm going to use amber with cannula and direct injection. So when you do Botox for a patient and you want to get rid of these lines, you know very well that you cannot do Botox here unless it's very superficial. And most of the patients that come are annoyed with these lines, are annoyed also with these superficial lines, which we can inject easily with amber very superficially, and it helps over time. Next is what? This line that was bothering you, which is the smile line. So in the past, doctors used to just inject this line. Nowadays, we fix the problem. So what is it that you have? What is the problem? The problem is volume loss. So in the past, something was holding the skin because I have extra skin here. So something was holding the skin. It was called fat.
Oh.
Fat is gone. Hasta la vista. Bye-bye. How many fat pads you have here? You have 4. So this is 1, this is 2, this is 3, and this is the 4th fat pad. That's why with age, when you start losing the fat, this fat pad is the one that stays. And because this is the fat pad that stays, what does it do? It presses here and give you this line. If you inject the nasolabial folds, you will give more heaviness over time and it will get worse. This is what we call over time the hamster sign. You know the hamster when they have this shape?
Yes.
We don't want to become hamsters, right? So we want to fix the issue. We want to replenish the fat that the patient has lost, which is mainly, if you examine her, it's the deep fat pad that is at the level of the bone, the lower lid fat, which is at the level also of the bone, and some of the lateral fat. Also, she has lost a little bit in her temples, but we're not going to inject the temples today. Maybe when I finish with the nappage technique, I will give you some nice lifting to the eyebrows. See, this is a red carpet event kind of a treatment. So for example, if you have a wedding, you have a party, you have a quick fix, right? And you don't want to inject yourself with fillers all the time. You just go to the doctor and you tell them, give me my red carpet treatment. And the red carpet treatment is the triple booster. So we're going to treat the nasolabial folds by treating the reason you have these nasolabial folds, as I mentioned, which is the volume loss mainly. And I'll show you with our 5-point injections how we're going to hook the skin as if you're putting nails there. Okay? Real. So we're going to do half of the face and I'm going to show you the result. Again, we go now to the marionette lines. which is very popular. Basically, patients that age with gravity pull, so their faces go down because they have a thick skin, they have a good volume, they have redistribution of fat that has gone down. So what we're going to do is we're going to help her, with the redistribution of fat by injecting laterally to the face, either with a 5-point injection or with the F5. I just decided to inject F5 not only with direct injection, but also with cannula, because I want to make your jawline longer. Okay? Then comes the necklines and the décolleté lines, right? You're a sun lover. Do you put creams?
Sometimes.
Sometimes. So when you have this crease, it's either from sun damage or from the yo-yo effect. Gaining weight, losing weight, gaining weight, losing weight, this happens even if it's 1 kilogram. Because, 1 kilo of fat is how much? This big, right? This famous question when they ask the patient, when they ask people which is heavier, 1 kilo of iron or 1 kilo of fat, which is heavier?
Fat, yeah.
Oh my God, it's 1 kilo everywhere. So it's 1 kilo. It's 1 kilo everywhere. So 1 kilo of iron is this much, fat is this much. So when we lose the fat, we're going to have all these, when you have on your belly, when you lose fat from your belly, you start having also these layers. This is your neck fat, like a belly, forms layers. So we're going to get rid of those. Shall we dance? Let's start. Okay. I'm going to wear my face mask. The patient's face is clean already. Can you hear me from the face mask? Anna, can you check if they can hear me from the mask? It's fine? Okay. All righty. So we're going to start by cleaning. I always like to treat the patient up down, but I always leave the nappage as my last step, okay? So we are going to start by doing the under eyes. And Natalia here, I know that I have light hands, but pretend like they are feather hands. Okay? Yeah. So we already prepared with the cannula. We already prepared. Give me the vial of amber. So this is the vial of amber from Infin. It comes in a 10 ml. Okay? You can see it. And we withdrew using 1 ml syringe. Usually when I withdraw, I use 18 gauge needles. It's a personal choice because I'm fast, I'm quick. I see a lot of patients per day and I don't have time to withdraw with the 27 gauge or any other 25 gauge. So I just take the 18 gauge and I just withdraw, okay? So this is 1 ml and we are using here 22 gauge cannula, okay? Oh, you shouldn't have seen that. But don't worry, it's not painful. It's a little bit annoying. So let's start now with our entry point. And I'm going to show you underneath the skin. So we're going to enter from here all the way. You remember I told you about the ligament? You remember the ligament is in the periosteum, is strong, it's rigid. So when you lose the fat, it goes down like this. Boop. So this is what has gone down like that. What I'm going to do is I'm going to replenish the fat that was there. So we're going to make the ligament go up again. Taking into consideration 2 factors. Can I have the white pen, please? The first factor is the volume loss here. And the second factor is the fistones or the water gain here. You don't want to inject this area, otherwise it will make it worse. Now, I'm going to do for you something called concealer effect. You know when you wear your concealer and you stop seeing this? We're going to show you this on the mirror. Entry point. So let me take the headband down a little bit and fix the camera accordingly. Are you comfortable? Are you comfortable?
Yes.
Headband. No, the head. The head. This one. No, up. This one.
This one.
This one? Yes. So fix the camera in a way that everybody can see. And tell me when I can start. It's okay? Yeah. 1, 2, and 3. So you know that you have to hold the skin like that, so that two things. First, you will cause pain for the patient using your finger, so they will forget the needle. This is a nice trick. And it will give you a guidance towards your layer where you want to inject. 1, 2, and 3. So let's withdraw now the direct point injection. I'm going with my needle. Deep breath. That's it, you're done. Not bad, huh? And I'm injecting. This is my amber. Like I told you, remember, if the patient has more, loss of volume underneath the eyelids, I would suggest the sanguine Q-tip. So that you can see the areas of volume loss. This is my ligament. I'm going to inject as well alongside of the ligament. And let's see if you're done. Q-tip. Again, how was it? Good? Bad? Ça va? Ça va. So, I'm going to give you the mirror. I'm going to let you sit up like that. And you're going to see how you feel.
Oh, wow.
Yes. So, what happened here is that we fixed the loss of volume in this area. We fixed the fact that the ligament was pulling everything down. And now I have one more area to fix, which is here, the hollowness, which is a little bit lateral to the fistone. Can I have again the cannula? I like personally to use cannula under eye for many reasons. Because most of the clients that come to us, they don't like to leave the clinic, bruised or swollen. So the cannula deviates from any vessel and gives a smoother effect. Prepare another one with cannula for the other eye, please. At the same time, it's annoying, but it's not painful. At the same time, it gives you nice coverage so that you can target exactly where you want to go. I'll give you now a trick. You see these lines? These lines, I call them warrior lines, these ones. These are from the ligaments. So we did a trick here of injecting with a cannula. Now I'm going to show you how, with direct injection, you can get rid of these lines. I need the yellowhead needle 30 gauge from the side. So this is an indentation at the level of the bone. So you have to go really deep up to the level of the bone and correct it. 1, amazing. 2, bravo. And you're done. That's it. Now sit up, and you can see the difference between white Bentleys and gauze. This eye and this one. And you can see also that the nasolabial fold has been corrected as well. Let's continue. So that was the first part of our triple, right? We said eyes, face, neck. First part of our triple. Let's continue. We will now go to step 2, which is our famous aqua booster. Can I have a white pen? And I'm going to show you now the famous 5 points so that you can get a beautiful lift to your face using mesotherapy alone and not fillers. So, how to get these points? First point is, okay. So we go from the nasal ridge and the point that crosses the midline of the pupil. This is my first point. Same here. Okay? Which one is my second point? Lateral lip, mid-face, make a nice cross. This is my second point. Lateral lip, mid-face, cross. My second point. My third point is me directing my pen or my needle towards the nasal ala, going from the jawline, 1.5 centimeter. Same thing here. Turn your face towards me, please. Going from the jawline towards the ala, 1.5 centimeter. Fourth is lateral to the eye, 1.5 centimeter lateral to the eye, at the highest point of protrusion, where the cheek have to be the most protruded. And the last point is anterior to the tragus. Can you open your mouth? This is the head of the joint, and this is where my point should be open. This is where my point is. Now, aqua booster, direct injection, using the needle that comes with it in the first place, which is what? Which one? 30 gauge. Let's start. So, again, I squeeze the skin. I go with the direct injection. I make sure I have support so that I don't go deeper. And I inject my 0.2. Done. You can see how the patient already has an instant lift. Second point, 1, 2, 3. Bravo. There you go. Third point, I tend to go really fast when I inject with my needle so that the patients don't feel anything. 1, 2, 3. Third point. This is the point that is a little bit painful. I'm sorry. Yes. You can put Q-tip. And finally, the last point. You can put it. Yes. Now you can see how the patient has a lift without using any fillers. Okay, up please. Ça va, Natalia? You're good?
Yeah.
So you see the result, the difference between a lifted face and a little bit of sagginess around here. Now, I can still see that she has sagginess here, loss of volume in this area. I can still hold the skin. And this is where the role of F5 comes into play. Okay? So we're going to start with the F5. This is the F5 vial. What does it have? Hyaluronic acid, succinic acid, collagen, hydrolyzed DNA, and hydrolyzed RNA. I withdrew in 3 ml syringe using 18 gauge needle. I always withdraw from the bottle with 18 gauge. It's faster and it's easier. Then we're going to use the 30 gauge needle. And this is a total of 3 ml. You can use it for the both sides of the face, or you can use half or half depending on the patient's volume in the first place. So I'm going to use it in a way that I'm going to give some nice lifting for the patient. Subdermal, I would say. 1, 2, and 3. There you go. I like to do my injections as if I'm lifting the skin towards me. So any area that you want to lift, you just pull the skin, inject. Pull the skin, inject. Pull the skin, inject. Pull the skin, inject. You okay?
Mm-hmm.
Look at the jawline she has now. Again, you see this line, you go horizontal. Pull the skin, inject. Pull the skin, inject. Same for my marionette. Same for the nasolabial folds. Bravo. You're doing excellent, Natalia. Let me see. From what I see is she will need more lateral lift. If you want to assess that, you just pull the skin. If you still have skin that is, prominent over there, you just inject more. And I like to inject a lot laterally in the lateral area because it gives a nice lift and gives a nice natural look for the patient without any volume, fake volume. There you go. Amazing. Now we're going to put some ointment gel on top, topical antibiotic. You're okay? All good? Little bit of massage, more gel, and we're going to reach our third point, which is triple. So single, double, now we reach the triple, which is the necklines. I chose for the necklines to do DNA. So DNA again comes in the file of 10. We withdraw using 18 gauge, and I'm using the 1 ml using cannula. Why cannula? Because she has deep lines. So if I go with my cannula and I do some dissection, without injecting anything, you will have a good result. Imagine if I'm injecting their DNA. Entry point, please. So there you go. 1, 2, and 3. Bravo. So how to do the cannula? You're not a bleeder here. There you go. So if you lose your entry point, you just squeeze the skin and find where the blood comes out. So see this technique of dissection? I didn't inject anything yet, and she already has a good result. So we're dissecting and injecting, retrograde. Again, change direction. Dissecting and injection. Again, change direction. Dissecting and injection. That's it. Look at the lines. Very much reduced, my love, very much reduced. Let's do more. Again, entry point. Dissecting, injecting, retrograde. 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 Same here. Bravo. And this is only using 1 ml of DNA. I can put 2. I can put 3. I can mix it with collagen. I can mix it with amber. Alrighty? Ça va? How do you feel?
Good.
So now I'm going to, the triple booster is done. Okay? So it's amber here, aqua booster and F5 here, and finally DNA here. I'm going to finish off with nappage just to show you when you do nappage on this side what happens. Nappage with the 32 gauge. Amber 32. So this is my nappage technique. It's fun, the nappage. We're going to do it everywhere. So really it's multiple small injections of amber. You can feel the trauma, right? A little bit, not too much. For the entire face, you remember how I taught you that you need to inject as if you're pulling? Same thing for the neck. Fill it up, fill it up, fill it up. Okay? Fill it up everywhere. Then continue to the décolleté, wipe the blood. And I'm ready to show you right versus left. I'm showing you if you want to do the whole thing, okay? For a patient that comes to you and tells you, I don't want fillers, I just want to have a result of the filler with meso. Fusident, please. Or Fusicor, it's fine. You okay? C'est bon? Good. I'm going to show you the patient looking straight, looking up, smiling, so you can see the difference. Left versus right. Some massage so that you forget the pain. And there you go. Can you show the patient the difference between left and right? And I think we'll take a photo for her. Can you sit up? First, I'd like to show you the difference. There you go. How do you feel? Good? What do you mean by good? Only good? Perfect. So take a look at the camera. Can I have Q-tip to remove the under eye makeup? Alcohol, please. These are tears of joy, huh? Close your eyes. Wipes, please. Okay. So take a look at the camera. And you can see how this side of her face, even her eyebrows, are lifted compared to this side of her face, which shows sagginess in this part. So she has lifting of the eyebrows. Can you look up, please? Look up. Difference between the under eye. Smile. Smile. Lifted cheek. Relax. Nasolabial fold. Not showing anymore. Marionette. Not showing anymore. Turn your face to the side. Jawline that is better contoured compared to that side, where she doesn't have the contour and she still has sagginess to her face. You remember when she used to smile and she has this wrinkly skin? Smile? Gone. Much better. Later on, I will teach you also how to do the lips. So write me whatever trainings you want to have, and I'll do the webinar accordingly. Again, how do you feel? Perfect. Good. So we can take a photo now for the patient, or we do it at the end. At the end? Okay. Changing my gloves. I'll do the second side. So I think I will go fast with that one, just for you to know how many minutes it will take you in the clinic. With me, it takes around 5 to 7 minutes. So again, what are we going to be using here? Let me see. By the way, if you can show from your camera while she's sleeping also, the difference between the right and the left side, I would really appreciate that, because it shows, especially with her wrinkles under eye. Is it obvious? You can see it? Yeah? So turn your face to the side. Check the wrinkles. Look at the camera. Smile. Check the wrinkles around the eyes. The nasolabial folds. Relax your face. And check how she has this lifted look all the way. Remember, this is meso products. Meso. Okay, I will start now by doing the other side. Would you like to go home one side down, one not down? So we're going to do the same. Underneath the lower lids, it's amber. Alcohol. Entry point. I'm going to do it fast. So I'm going to show you how I'm going to do it underneath the skin. We go from the entry point towards the corner of the eye, and then we do some injections at the level of the bone. We retract. We go back, and we inject at the level of the ligament. We retract. We go back, and then we inject here lateral to the fistones so that we can give her a concealer effect and, get rid of this bump and valley effect. So everything will be all smooth together. All righty? Inject, retract, inject, retract, inject, retract. Corner of the eye, level of the bone, ligament deep, and also lateral to the famous fistone. Cool? 1, 2, and 3. Turn your face to the side. Can you see clearly? Okay. I like to change my cannula all the time. So let's tap. This is the tip of my cannula. I go deep breath, and then I'm in. Perfect. You're fine? Make sure to prime before you start. So I did injections here. See where I am? At the level of the bone. I'm retracting, going inside again, injecting at the level of the ligament, retracting, injecting lateral to the fistone. Now you're gonna see a sound like that. Pah! This is me punching the ligament here. 1, 2, and 3. It's harmless and it's actually beneficial for you. Again, once we have direct injection, yellowhead, 30 gauge needle, you see this indentation here? The warrior lines. We're gonna use the rest of the ember. Here, we inject very deep for us to give her a nice lift. Now, going to step number 2, which is the aqua booster. 5 points, again. So this is my first point. Highest point of projection. We did our drawing before, 2 ml. Same thing here, 2 ml. Directed towards the ala, 1.5 ml from the jawline. Here you have more volume loss on this jawline. You recognize that, huh? This is the crisscross point. And this is, I'm so sorry. As if you're doing your injections for the soof. We added here a little bit because she has volume loss more here. And on the lateral jawline, I'm just going to cheat a little bit and add some aqua booster there to give her a nice jawline like this one. She has also 0.1 ml there that is left. I'm going to use it because you have more volume loss on this side, right? If you would choose also another product in this area, that would be BTX with L combined together. I don't like to say to the patient, to the doctors or anyone I train how many to put, like 1 ml or 2. No, this is ridiculous. You just know how much the patient needs. Now we're gonna go to our other technique, which is what? Lifting, injecting. Perpendicular to the lines. Let's start with the cheeks. Lifting, injecting, lifting, injecting, lifting, injecting, lifting, injecting. This is F5, right? I need to change the needle head. If you feel like when you are injecting the patient like there's some resistance, change the needle right away. You good? Am I torturing you? It's the sweet pain, no? Happy pain. So let's go also perpendicular, see? To the crow's feet. Perpendicular to the crow's feet. Again. Because here she has more wrinkles on this side. And press, massage. Again, lateral. Cheeks, lateral. Jawline, perpendicular to the marionette. All the way to the end, perpendicular to the nasolabial fold, all the way to the end. Amazing, amazing. I love it. Then also, since this product has succinic acid, collagen, hyaluronic acid, DNA, and RNA, I can notice that on this side, she has also some, you said, pores and acne scars as well, right? Did you have chickenpox as a child, right? So you were playing with this one. So you can go underneath it, dissect a little bit, and inject. It will help also. You know that these products have nice antibacterial effects, right? I would like also here to inject the jawline to give her a nicer lift. So if patients have acne, they are very good in the treatment of acne. Of course, combined with facials and making sure that the skin is clean. I go along the cheek and draw my egg-shaped cheek. Yeah. If you remember, we're going to end up with the neck, the DNA, and then nappage, and then vamos a la casa. Finished. Done. Hasta la vista, baby. Happy? Yeah. So, again, what is this technique? If somebody can remind me. Enter, dissect, retrograde. So, again, enter, pop, 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 dissect, retrograde. Enter, dissect, retrograde. Enter, dissect, retrograde. Change direction. One more time. You're almost done. Enter, dissect, retrograde. Dissect, retrograde. Enter, dissect, retrograde. Enter, dissect, retrograde. All righty. Done. We finish off now with the nappage, and then we can send you home. Nappage is using amber. This is additional to the triple booster because she needs it, and I felt like teaching you this. Same thing. You're fine? I'm doing some nappage here at the level of the eyebrow because I want to give you a nice lifting effect. Change the needle head, please. If you feel like the product is not going in, right away change the needle head. Gauze with alcohol, please. Ça va? You good? Smile again. See, when you see these lines, this is beneficial with nappage. Okay. Pull the skin, inject. Pull the skin, inject. Pull the skin, inject. Everywhere. Bravo. Almost done, my love. Smile. Yes. Gone. You know these lines that go from here towards the cheeks, they don't go with Botox. These require more volumizing. And now you saw how they were treated with nappage. We finish off by applying the cream. Twist it in, please. Merci. And our beautiful patient is good to go. Send me all your questions. Send me all your photos. Send me your work. I'm interested in seeing it. I'm interested in learning from you. I hope you learned some nice stuff today. I hope you like it. And I really, really, really hope that you are using Infin. And if you're not, that you start using it. Thank you so much, guys. And à la prochaine. Next time for our next webinar. Thank you so much. You can sit up and smile to the camera. This is your mirror. And you're done, young lady. Look at the camera, smile, and say bye-bye. Say Infin.